I hope everyone's doing really well. Very excited to kick off this session. This is our initiative to keep the community together for reconnecting and recharging during these stressful times. We've been going nonstop for the last nearly 3 weeks plus, I think, and that is amazing. We've done sessions on yoga, meditation, fun, taking a pause this week, emotional healing. And I'm very excited for today's session because this is going to be different than all the other ones we've done. I've known Dr. Shweta for a while now. She's the best dentist you can have in town. I work with her personally and on my business goals and her business goals. So we're together part of multiple communities. But I think dental health is something which we don't talk about enough, right? We talk about emotional health, mental healthness. अभी बहुत सारे sessions चल रहे हैं, but nobody has talked about dental health. And here I am. I think I will let Dr. Shweta take it over because she is going to be the best at this. Thank you so much on behalf of IWD. Thank you so much for doing this
Thank
session.
you.
Thank you so much for doing this for the community. Thank you.
Thank you. Thank you. Girls, whoever is here, if you all can just put in the chat box how many times in this month has anybody told you, or you've thought yourself, is it that time of the month and am I overreacting to this because I'm having PMS? Or am I going to get my period quickly? Is this the reason why I'm feeling so emotional? इतना emotional चीजों का बात हो रहा है, तो I thought let me start with this, because today what we are going to discuss is something quite personal and also important, because a lot of us don't talk about or don't know about the correlation of women's health and oral health, right? There's very strong correlation starting from the time. Now we are at one point, we were also daughters and we were about to get our periods. तो वो टाइम से जो जर्नी शुरू होता है of the connection between what happens in your mouth and what happens with your hormones is something that all of us should be aware, because either we are moms of daughters or we are ourselves going through a lot of things. So mentally, of course, we get affected by the hormones, but how many of you all know that your hormones are directly having an impact on your mouth right now? If you all can put your cameras on, or even if you want to use the chat box, I want to keep this interactive because I don't want it to be that I'm talking and you all are getting bored. So I just want, if you all can use the chat box and let me know how many of you all knew that hormones affect your mouth. I hope there is a direct correlation. Thank you, Neetu. So Neetu said that she was not aware. Sheetal knew. That's very good. Yeah. So we're going to walk through, or maybe take a quick journey down memory lane. How many of you all remember at what age did you all get your first period? This is a no judgment zone. We are all women. We all know that we all get periods. So there is nothing to feel shy, right? This is a health. We are going to have a conversation. Yes, absolutely. Dr. Seema has written that the whole body gets affected. That's absolutely right. When did you all get your first period? I got mine when I was 11. So from that time onwards, obviously, Brushali, my God, you really lucked out at 16. That's very good, yeah. That's amazing. So at Sheetal is also got it at 15 or 16. The reason why I'm talking about this is that from that time onwards, the hormones start affecting us and our oral health, and also vice versa. So that is the reason why we are talking about it. I'll slowly also go about why it is relevant at this time. Yeah. So basically, when you get menarche is when you get your first period. Essentially, the bacteria in our body also starts changing, right? Everywhere, starting from your mouth to your entire gut to your other private parts, everything starts changing. Now, when that changes, you get something called as, you may or may not have heard about it, something called as puberty gingivitis. Meaning there is a specific kind of gum inflammation that we see in teenagers. This may not be restricted only to girls. It's also, you see it in boys. And typically we also know that all the teenagers, any mums of teenagers here? Teenager mums or preteens?
Yeah, doctor, I have a teenage son, 14
Yeah.
years.
Yeah. So we all understand that how difficult it is to make them brush, right?
Yes.
Yeah. And how more difficult it is to make them brush in the night. Correct?
Very
That,
true. Like I have to behind him. Bhai
correct.
jaake brush kar le.
हाँ, वृशाली का बेटा उसको खाना बनाने में हेल्प करता है पर ब्रश नहीं करता
बाकी बाकी टाइम में पूरा मुझे टफ टाइम दे देता है वो।
है। Correct, amazing.
मेरा
But the
बेटी भी
idea is that that
मॉर्निंग में ब्रश
combination.
करे ना, राते तो दूरस्त है।
Oh my God!
Wow, I saw that. Yeah, amazing. So the idea is that when the change in kind of
Sorry,
bacteria.
sorry.
No, no,
I
I'm
was,
very happy. We
I
got a
was,
live demonstration.
I was telling my daughter, and she was screaming.
Boy, that's what I said. We got a live demonstration of how difficult it is to make them brush. So thank you for that demo. But that's the idea. So increase in like a lack of oral hygiene at that age and the change in hormones, you see a lot of bleeding, right? And bleeding gums are not normal, right? How many of us know that bleeding is not okay from the mouth? Do we all agree that bleeding gums
Yes.
are not normal? Correct. The best analogy or the best example I like to give is that when you wash your hands, if they bleed, will it freak you out? Will it like worry you? If you went to wash your hands and you saw that blood was coming out, it would, right?
Yeah.
So the same thing when we are brushing our teeth and when we see blood, it usually doesn't affect us the same way. Correct? We always think कि नहीं जोर से brush कर दिया होगा, ऐसे हो गया, ऐसे कर दिया होगा, वैसे इसके लिए हो रहा है. But it's not normal, right? And especially if you see your teenage daughters or sons having bleeding gums, please take them to the dentist and show it and get it checked. It's not good to have bleeding gums. उसके बाद में क्या आता है next stage हमारे life में? The other big thing that we do after we get periods and then we decide to take the big step of getting married. And then what do we do after that? We decide to take this massive step of becoming a mother. Correct? So when we decide that, उसके बाद में उसके पहले भी एक अच्छा step है which we should discuss because maybe a lot of the people are here are doing that, is when you are doing family planning or deciding not to have a baby for that particular time, a lot of us also take OCPs, right? Oral contraceptives. So when you take oral contraceptives, again, because I wouldn't say messing around, but you are playing with the hormonal balance. Again, you see changes. I see a lot of patients with dryness in the mouth, suddenly increase in bleeding, and also bad breath. A lot of my patients have come complaining about bad breath when they are taking oral contraceptives. Right? So these are things that happen and we are not able to pinpoint why it may be happening. So dehydration is another very common reason in and around periods, around your ovulation time. So everybody, like the reason why I'm talking about this is I want all of you all to self-analyze, and a lot of things you can do at home. It's not necessary कि हर चीज के लिए आपको डेंटिस्ट या डॉक्टर के पास भाग के जाना है. Just understanding our body and working around it sometimes can make a lot of difference and it can help you. So a lot of people I've seen is during ovulation also. So that is typically around 15 days before your period time, correct? So around that time also you will see changes. You'll either see a very peculiar kind of bad breath or maybe not bad breath, but you'll see a particular kind of odor, right? Even body odor, we feel that sometimes in that cycle time, you will see that wo ho raha hai, aise ye time pe mere ko, I feel that like that, correct? So these are things that you need to understand. Nothing to be done. Oral contraceptives, another thing you have to be very careful is if you are taking any antibiotic during that time, it makes the oral contraceptive inefficient. It reduces the efficacy of your oral contraceptive, so your chances of becoming pregnant become higher. So you have to keep that in mind. And you should always, if your doctor gives you an antibiotic, make sure that you tell your doctor that you're having an oral contraceptive, because sometimes it slips out of the mind, right? It's important. उसके बाद में आता है the big P, which is the pregnancy. Pregnancy में कितने लोगों को, how many, all the girls here moms? Do we have somebody who's not yet married or not yet doesn't have not gone down the baby route yet? All our moms, right? Almost all our moms. So if you are a mother, you know what happened during pregnancy. Everything changed. So it's like a, for your system, it's like a menopause at that time, correct? Because you're growing a baby. आपका सब कुछ change हो जाता है. There is a lot of dryness in the mouth. There's a lot of what do you say, bleeding. Again, bleeding is one big thing that happens all the time. तो किसी भी phase में आप देखोगे until you hit menopause. When you hit menopause, and there is a different story that goes on. So in pregnancy, what do you need to do? And how many people think that it's unsafe to do dentistry when you're pregnant? Anybody here? You can be, I mean, this is a, I told you, this is a safe zone. जरूरी नहीं है कि आपको कुछ बोलना है जो आपको लगता है कि मुझे सही लगेगा. Please tell me what you think. If you think that it's, you know, it's better to avoid going to the dentist during when you're pregnant.
Yeah, Sheetal here.
Yeah,
I
Sheetal.
had bleeding gums during pregnancy and had gone to the dentist, but I wasn't sure whether I should be taking those medicines or not because I was having a baby after 8 years. So like,
correct. So during pregnancy, you can easily go at any time for a cleaning. Cleaning will never ever affect you in any other way. There are certain things like people earlier we used to take X-rays, physical X-rays, जिसका radiation बहुत ज़्यादा होता था. अभी तो pregnant ladies में भी बोलते हैं because we take digital X-rays, the radiation dose is so little that आप मोबाइल फोन अगर लेके घूम रहे हो तो उससे जितना आपको डोजेज आ रहा है उससे कहीं कम है the dental x-ray ka. But anyway, most people still don't prefer. So I wouldn't say first trimester, third trimester, easily you can get anything done. Because agar aapko daant mein ya kahin pe bhi you are having trouble and we are ignoring that, that is also releasing chemicals in your body, right? When you are having an infection, when you are having pain, your body is releasing chemicals to take care of that. That is also affecting your baby. So sometimes we feel, I don't want to take medicine or I don't want to do this because, you know, we are obviously very protective of the child inside us, right? कि हमको लगता है उसको कुछ हो गया, like, you know, I don't want the medicine to affect. But we also have to keep in mind that if there is any kind of infection anywhere in the body, not necessarily only in the mouth, it is affecting also because it is also releasing chemicals. तो उससे अच्छा है कि आप 2-3 दिन का कोर्स लेके वो इन्फेक्शन को कंट्रोल में ले आओ so that the rest of the time you're fine. Correct? That is important. Now, after pregnancy, then you're feeding. When you're feeding, again, we are scared कि भाई अभी मैं उसको I'm feeding the baby, so then how will I take medicine and what will happen? But you also, you know, you cannot pour from an empty cup. You have to look after yourself. You have to take care of yourself. So if you've been putting things away during that pregnancy time, then when you're nursing the baby, it's the best time to go and get stuff sorted. Correct? उसके बाद में क्या होता है? उसके बाद में शुरू होती है हमारी जिंदगी की भागदौड़ कि बच्चे को भी देखना है, बिजनेस भी चलाना है या जॉब पे भी जाना है, घर भी देखना है. We are doing, you know, Dr. Seema has written something. Let me see what she's written. During pregnancy, I think diet should support good teeth for child. Yes, it's very important because if you are very sick, thank you for bringing that up actually. If you are very sick when you are pregnant, you will actually see that in the milk teeth. And if the child is very sick or something happens, you know, बहुत बीमार हो जाते हैं बच्चे, तो we see that in the permanent teeth because the permanent teeth are forming somewhere in the first 3 years of the child's life, right? So if they fall very sick at that time, then you will see that in the permanent teeth we see hypoplastic or certain, you know, deformations in the tooth, which makes it more prone for cavities or something like that. Any questions so far? Does anybody have any questions? Charu, have you gone to make your daughter brush? सब चले गए क्या?
No, I'm here. I'm here.
Okay, cool. I was wondering, इतना सन्नाटा क्यों है भाई? हाँ. Anyway, so the idea is that I think everyone is busy, so I will just talk about menopause now because anyone here close to perimenopause or menopause in their late 30s, early 40s, late 40s?
Yes, I'm 42 now.
You're 42, I'm 44. So we are all in that phase where we are menopause at 45. Okay. So that's what. So basically ये वाला जो phase है ना, ये क्योंकि फिर काफी साल चलता है, correct? This is another phase that we go through. Now, hormonal changes are there, emotional changes are there, hot flushes are there. In this phase, you will see, because there is a general reduction in the sort of, what do we say, lubrication in the body everywhere, right? The moisture levels in your body, everywhere it goes down, including your mouth, including, that's why you feel so much of dryness, correct? Because even the doctor will give you creams to put, they will give you creams for your private parts if you need it. Same thing happens in the mouth, because your mouth is also becoming dry, so your chances to get cavities, etc., increases a lot. Correct. So when that happens, how can you take care of it at home? Make sure that your water intake is very high. Make sure that you are brushing very nicely, because sometimes that gets ignored because there are so many other things going on in the body. हम लोग जल्दी से brush करके निकल जाते हैं. It is also important to use something to clean in between your teeth, because as we age, there is a tendency for all of your teeth naturally for all of us to move towards the midline. तो अगर आपके दांत अच्छे एकदम ही अलाइंड भी थे ना, as we grow older, you will start seeing some amount of crowding especially in your lower front teeth. You will see that they're moving closer together. So when the teeth start moving closer together, you will also see that it's more difficult to keep them clean. When that happens, then again you will get more cavities, again more issues, right? Another very interesting thing that we see in perimenopausal and menopausal women is समथिंग कॉल्ड एज डिस्क्वामेटिव. तो बहुत लोगों को होता है कि भाई अब मैं स्पाइस नहीं खा पा रही हूँ, अभी मैं थोड़ा सा भी ज्यादा खट्टा खाती हूँ तो मुझे मुंह में ना ऐसा लगता है कि खिंच रहा है मेरा मुंह, एंड वेरी डिफरेंट काइंड ऑफ फीलिंग. देयर इज अ बर्निंग सेंसेशन इन द माउथ. There's maybe, like, you'll actually see a lot of redness, and you might even see peeling off of the gums. If any of that happens, then you should go and visit your dentist, because it's a particular kind of very, very minor inflammation, but it is not related to getting your teeth clean. It just needs a short-term steroid treatment typically. Yeah. So it's important, and it's getting more and more common because also our lives are becoming far more stressful. तो ये स्ट्रेस का डायरेक्ट कोरिलेशन है, इसमें बहुत जरूरी है जाके दिखाना. एंड समथिंग वेरी सिंपल आई वांट टू शेयर विद यू ऑल right now. Can you just check very quickly what your teeth are doing? Are they in contact? No? Did you just break the contact? If you did, I'm happy. So every now and then, especially अभी जैसे दिन चल रहे हैं हमारे दुबई में, there's a lot going on. Our mind is processing a lot of information and is also coping with a lot of information, right? Which anyways we are doing, because all, as women, all of us are multitaskers. You are all moms, you're all business owners, you're all, running, घर भी चला रहे हैं, इंडिया में भी घर का देख रहे हैं, पेरेंट्स को भी देख रहे हैं, इन-लॉज को भी देख रहे हैं, सब कुछ कर रहे हैं. So there's a lot going on, and there's a lot of processing that happens in our mind. So when that happens, you will see that the way our body copes with this, and the most easiest way for our body to cope with this stress, any stress, it can be even physical stress. When you go to the gym, is there anyone who does training with weights? Yeah, Meena has written there is a tendency of grinding teeth in the night. Yes, very, very true. That's what I'm coming to. So the best way to find out if you are grinding or clenching in the night is during the daytime. Randomly take your attention to your teeth, like I just asked you to right now. Suddenly आप देखो आपके दांत क्या कर रहे हैं. अगर वो कांटेक्ट में है ना, जरूरी नहीं है कि एकदम ही टाइट कांटेक्ट में हो. अगर हल्के भी कांटेक्ट में है तो आपको सिर्फ you have to blow a bubble and just exhale. Automatically the contact gets broken. So what is normal? When should your teeth be in contact? There are only 3 times that your teeth are actually allowed to be in contact. One is obviously when you're chewing your food, your teeth need to meet, when you're swallowing your food, and when you're talking. Because to make certain sounds, our teeth need to come in contact. Apart from these 3 things, हमेशा हमारे दांतों के बीच में गैप होना बहुत जरूरी है. There should always be a gap. Yeah. And if you don't see that gap, start with just being mindful about it. उससे ही पता चलेगा. तो अगर आप दिन में, if you find yourself के 3-4 बारी मैं चेक किया and my teeth are in contact, then congratulations, 100% you are grinding your teeth in the night. Okay. So we need to do some facial muscle exercises every now and then just to relax your muscles and to break the habit. Very easy thing that you can also do is get your I'll share the link. I'll ask Rima, she can share it. Even off Amazon, you can buy these homemade night guards that you can make at home. Start wearing those. If you don't want to go and get it made from a dentist, Amazon pe bhi milta hai. Just buy that and start using it. The reason why I'm talking about this specifically is that from the time this has started, every day in my clinic, I'm seeing one patient who has cracked their tooth and come because they are grinding and clenching so much every single day. I'm not making this up. It has actually freaked me out. This is the reason why I reached out to Rima also. I actually wanted to talk about that because it is impacting us in so many different ways and we are not even realizing. क्योंकि लोग इतना क्लेंच कर रहे हैं कि वो अपने दांत को वर्टिकली तोड़ रहे हैं. कैन यू इमेजिन कितना आपको क्लेंच करना पड़ेगा कि अगर आप दांत को तोड़ के आ रहे हो क्लिनिक, right? So it's not good. We have to find ways. That's why I'm so actually I've attended Vrishali's session yesterday. It was so good, and I think we all need to find that kind of time and relax and de-stress a little bit and hang out with each other and have some fun. तो वो बहुत जरूरी है. स्ट्रेस वाला एंगल में जितना स्ट्रेस वाले एंगल पे जितना ज्यादा स्ट्रेस करूं वो कम है. It is very important. Do facial exercises. There are very, very easy things that I will show you that you can do. One is the fish pose, yeah. मतलब इतना हमको करना है कि यहाँ पे आपको दर्द होना चाहिए. It should actually hurt a little bit, yeah.
I never knew this, but I don't know because of Shrihan. I keep doing this. मैं उसको fish बना के दिखाती हूँ उसको. उसको बहुत पसंद है. So he keeps telling me, "Mama, fish बन के दिखाओ."
फिश बन के दिखाओ तो आप अच्छा है. यू फिश बन के दिखाओ और उसको बोलो अभी आपको बलून भी बन के दिखाऊंगी. सो यू डू बिकम अ पफर फिश नाउ. आफ्टर दिस यू बिकम.
Yeah, we do both. Like I do both for him. हम लोग वो जैसे ही हम लोग कभी ऐसे टीवी देख रहे हैं कुछ उसके बीच में कुछ तो उसका चालू होगा कि मम्मा मम्मा अभी फिश बन के दिखाना अभी फिश.
Very nice.
Then he will
That's
make
very
me
good. So unknowingly you're already doing the facial exercises.
What is
Yeah.
the benefit of this?
This relaxes your facial muscles because if you are grinding or clenching na, these muscles are also constantly in overdrive, and after some time वो habit हो जाता है. तो एकदम high level का stress अगर नहीं भी है, then your body is still clenching and grinding. That's the reason why I was saying that we should buy it off. Even if you buy it off Amazon, it's fine. एक simple सा वो plastic का आता है night guard. You just wear it at least for a few hours when you're awake in the day.
Okay.
Yeah, and then this, what I'm showing, these exercises are for to relax your facial muscle. Even a great thing to do is, you get those rollers, those jade rollers and all that.
Yeah.
That massaging upwards is very, very good. Take any moisturizer, take out 2-3 minutes for yourself in a day and do these things. Yeah, and also blowing bubbles with a straw. You can make it a fun game with your children and do it. It's actually really fun. Or you get those the boba balls, na? You try to suck it out and put it in a. You know how we do those 1-minute games? जो मस्ती में करते हैं कि 1 मिनट में कितना डाल सकते हैं straw से. All those activities will actually help you release your jaw muscle tightness. And that will actually reduce your chances of cracking and breaking your teeth. Because if your muscles are relaxed, you will not be clenching. Yeah. So very, very quick. I don't want to keep you all for too long. Idea is that the takeaway is there are all through your journey as a woman, from the time you get your period to the time you, that's my daughter.
Introduce me.
Yeah, she said you introduced me, so I might as well say hi. So, so idea is that from the time you get your first period until we stop getting our periods, your body is going through a lot, but we also have to respect the fact that our mouth is very much a part of our body. And जस्ट इमेजिन, जो भी हम खाना खाते हैं, मतलब आपको जो न्यूट्रिशन मिल रहा है, उसका फर्स्ट पॉइंट ऑफ कांटेक्ट आपका मुंह है, इज योर माउथ, राइट? And if that first point of contact is not healthy, every single morsel of food that is going inside is getting coated with bacteria and going inside. So you do need to take care of your mouth. You do need to take care of your oral health. And there's a lot of research that now shows that if your oral health is not good, you're actually at a higher risk of developing other issues. We have data to prove that women who have gum disease are at least 1.5 to 2 times higher risk of having preterm deliveries. Preterm low birth weight babies, you know, when a baby is called low birth weight, when it is less than 2.5 kgs. And preterm is obviously before you complete your full term of 36 weeks. 36 पे हम लोग full term बोलते हैं. उसके पहले babies होने का ज़्यादा chance है. So how does that happen? Because just imagine, if you have any infection in your body, even if it's a low grade infection, it is constantly releasing chemicals. And these chemicals, the actual chemical that gets released is the same chemical that the body produces when you have to induce labor. It's basically prostaglandin. That's the chemical that gets released in any inflammation, any infection. And unfortunately, it's also the same chemical mediator that is released before we want to go into labor. I mean, before the body goes into labor. So, agar aapka, yes, absolutely, Dr. Seema. Very, very strong correlation right now, again, coming up between gum disease and gum disease causing heart issues. राइट? सो इट्स नॉट ओनली कि आपको सिर्फ स्माइल सुंदर दिखने के लिए चाहिए, आपको अभी जिंदा रहने के लिए भी आपके स्माइल का ख्याल रखना बहुत जरूरी है. एनी क्वेश्चंस? सो quick checklist I will give you, what I want you to do today for yourself. This is not for me or this is not for anyone else. Today when you go for your shower, if you've not had it, go to the bathroom, take your phone torchlight, okay? I want you to open your mouth wide and move your cheeks like this and check everywhere. Do you see any redness? Do you see any redness? Meaning you will come to know if it's not looking normal, right? Agar sara hi red hai, to then you will be in pain. But agar it should be light pink or dark pink. As Indians, typically we have darker gums because we also have melanin. Jaise apne skin mein hota hai, you will see maybe a darkish hue, that's fine. But you should not see any spots of redness or any spots of like white. You know how we get, like जब भी लग जाती है हमको तो वो scab form होता है ना उसके ऊपर. You know, when we get hurt, you see that scab formation. So you see like a सफेद whitish scab. If you see any of that, these are all signs that you need to go and see your dentist. Yeah, don't ignore it. And any bleeding from your mouth, any bad breath, any kind of pain or discomfort, don't ignore. Yeah, bad breath again is another very, very thing, because as women we have very erratic eating habits. How many of us are eating very regular meals? अभी तो सारे घर पे बैठे हैं तो सारे शायद खा ही रहे होंगे, but not now. In general, when you're out and about, a lot of us have this habit कि अरे breakfast खा लिया, अभी मैं देखती हूँ, on the go, having lunch, maybe skipped a meal, all of that, right? When that happens, your body is also becomes acidic. Acidity form hoti hai na, because your stomach wants khana. We are ignoring the signal the stomach is giving. The stomach will make acid and it will regurgitate it. Regurgitate matlab it will keep bringing it back into your mouth, making the saliva in your mouth acidic. Aapko zaruri nahi hai ki you will feel uncomfortable or I have to feel that I'm feeling acidic. You don't have to. If you have long gaps in your meals, you will see that the mouth becomes, your saliva becomes acidic, and you will have more problems and you will have bad breath. Okay, so have more water, reduce your coffee intake, and if you're having coffee or tea, a lot of tea and coffee, ensure that every cup of tea or coffee is then succeeded or followed by a glass of water. This is very important. Anybody, I mean, it's fine. Anybody smokes here? Smoke, shisha, vaping? कोई करता भी होगा तो अभी बताएगा नहीं आप. But if it's okay, I mean, I said this is a safe zone. If you are, it's fine. So the idea is if you're doing that, ensure that you have a glass of water every time. Or if your husband smoke, टेल देम दैट अगर आप सिगरेट पी रहे हो तो उसके बाद प्रॉमिस करो, एक तो छोड़ दो, अगर नहीं छोड़ पा रहे हो तो हर सिगरेट के बाद में एक गिलास पानी पीना बहुत जरूरी है. Yeah, that's it. I don't want to take too much of your time. Is there any questions, anything you all want to ask me? The floor is open. Please feel free to ask me anything related to oral health or anything that if I can answer, I'll definitely answer.
Doctor, how about oil pulling in the morning, like to keep oral health well,
So,
at least?
very good. I'm very happy you asked that, Roshali. So oil pulling, na, there are two things. One is you need to ensure that you're doing it with very good quality oil. Okay. And the second thing is you actually have to put a timer 10 minutes ka and do it. Only then it is said to have any benefit. Okay. Now, is there any research to show that it is really helpful? There is no research to show that it's beneficial, like proper high quality evidence. But at the same time, there is no evidence to show that it's harmful also. तो अगर
Okay.
आपको लगता है कि आपको उससे फायदा होता है, then you do it. There is no harm. It's not harmful for sure. How much benefit is there, we don't know. Yeah.
Okay. Okay.
Let me put something in the chat. Meena is asking how long should you wear the retainers? This retainer is this the one that that I said, like the night guard, or are you asking about general retainers after braces? Okay, so that one you need to wear it for a long time because वो जो store bought वाला है उसका फायदा होने में आपको time लगेगा. Yeah. The remedy for teeth grinding at night for teenagers is also similar to what it is for grown-ups. If they've not had, sometimes in some children, you will see that they night grind because they are having a issue. They may need braces. So it's not a bad idea to take them, and if they've already not had braces, to go and visit an orthodontist and get it checked. Because sometimes some children do night grinding because the teeth are not sitting in the right way. If there is a bite issue with the bite. So the best thing to do is to do an orthodontist consultation. Sheetal is asking if using mouthwash on a regular basis is okay. As long as it is not replacing your brushing or flossing, it's fine. But if you're using a mouthwash, make sure that you're using a non-alcoholic mouthwash. तो लिस्ट्रीन आप नहीं यूज करोगे. 0% वाला लिस्ट्रीन आता है, zero alcohol listerine, that's fine. Colgate Plaques is fine. Any of these ones are fine. Again, medicated mouthwashes we don't want to use. So a Parodontax mouthwash, Betadine, do not use because they are very strong antibacterials. तो वो क्या करता है, आपके जो अच्छा बैक्टीरिया भी है आपके मुंह में, long term में it will kill it, and then we become more prone for fungal infections in the mouth. So ideally, if you don't feel like if you're brushing and flossing, you should not feel the need to use the mouthwash. But थोड़ा लगता है कभी lunch के बाद में, just many people like that थोड़ा freshness लगता है. Non-alcoholic mouthwash is absolutely fine. Meena has written, this is for me. The night guard, you need to wear it for a very long time, Meena, because if you're just going to buy it off Amazon and use it, it will take very long to work. So start with a couple of hours in the day for the first 3-4 days because it does take some getting used to. After that, you will start wearing it slowly in the night every day. And if you're working out in the gym, also when you're working out. It's very important. But gym वाला मतलब जहाँ पे हम weights उठा रहे हैं या हम कुछ heavy कर रहे हैं. Also you see, right, when we are working out in the gym, you will see people working out in the gym. They always, when you have to do heavy weights, you have to clench. So even patients who have are heavy, fitness freaks also have this issue. Manju, I hope I answered your question. Any other questions? I
I
think
think we are done with the questions. Does anyone else have any other
Mm,
questions?
no.
no, no. Cool. I'm glad. So I think we're done then.
Great.
Yeah.
So thank you so much, Dr. Shweta, for such an
Oh no,
insightful
somebody has
session.
question.
Ah, okay.
Which
One, yeah.
toothpaste to use? Any white toothpaste. Don't use any herbal toothpaste. Don't use any gel based toothpaste. And don't use any whitening toothpaste on a long term basis. Herbal toothpaste are an absolute no because they are extremely abrasive. Okay. Over a period of time, when we use any brand, it doesn't matter which brand it is, वो दांत को घिसता है बहुत ज्यादा. Your gums and your, so the highest, Meena, please do not use Patanjali. I was just coming to this one. Matlab, I don't want to bring any, I don't have anything against any brand, but the maximum number of allergic reactions that I have seen in my patients' mouths have been with Patanjali. When Patanjali had just started, it, I had, you will not believe, like these cracked teeth. I had log India summer ke baad mein people were coming and everyone got these toothpaste and came. And then in a series of patients, I started getting like what I was telling you, the peeling off of the gum and this redness and all that. The first two or three patients, I was like, I had to take a proper history to understand what's happening. And then it came down ke bhai ye naya toothpaste change kiya hai. The minute we stopped the change the toothpaste, they were fine. After that, I just started asking my patients directly, क्या आप Patanjali use कर रहे हो क्या? And they would say yes. And then the problem would solve. So please don't use Patanjali, Dabur, Himalaya, no herbal toothpaste. Any सफेद toothpaste, Colgate Total, Pepsodent, Signal, Crest, जो भी आपको ऑफर में मिलता है 3 के पैक में, वो उठा लो और वो यूज करो. क्योंकि ब्रशिंग में आपका Parodontax is okay if you are happy with it. There's no problem with Parodontax. It's also safed, na, white wala. I don't want gel-based toothpaste because gel-based toothpastes are again very abrasive. Yeah, that's it. Thank you so much. Sensodyne is also fine, Meena. Sensodyne also you can use as a regular toothpaste because now they've marketed so much directly to people that they've lost any medicinal quality that they had. So they've become like a regular toothpaste now. So you can absolutely use it. Okay, guys. Thank you.
Thank you. Thank you, doctor.
Thank you, Roshali. Thank you for coming.
Thank you.
Dr.
Anyways, I
Sima
have to come to see you
asked me,
in person.
yes, I think our meeting is long overdue. Seema,
Yes.
Dr. Seema has written how to reduce mouth dryness. How to reduce mouth dryness. Immediate impact you will have. There are certain mouthwashes called TheraBreath, etc., which will help you in reducing your mouth dryness. But most important thing is to understand why we are getting the mouth dryness. This is typically a sign of dehydration. We need to increase our water intake. Again, like I said, closer to perimenopause, menopause, it's very, very common. So you need to up your water intake at that time because your water necessity for your body increases at that time. Yeah. Also, multiple reasons. अगर आप बहुत ज़्यादा medication ले रहे हो, diabetic for a long time, like we need to understand the medical history as well. Yeah, if your water intake is fine and you're still feeling that no, my mouth is very dry, then we need to look into the medical part of it. Like, is the patient a diabetic? Is the patient having a lot of medications for other issues? All those things will make a difference. Yeah, thank you.